Happy Nurses Week. I want to begin by personally thanking each and every one of you for the work that you do every day at Penn State Hershey Medical Center. I can't thank you enough for the knowledge, the dedication, and the compassion you bring to the bedside. Our patients compliment us on a daily basis around the work that you provide, the compassion and the caring that you show to our patients. You know, Mother Teresa used to have a small saying that said, "Do the small things with great love." That's what I see nurses at Penn State Hershey Medical Center doing each and every day here. You do the small things with great love.
Hi, I'm Nancy Carrington, Director of Surgical and Emergency Nursing at Penn State Hershey Medical Center. We have dedicated the resources to strengthening and improving our discharge process for patients, which leads to better patient outcomes and a reduction in our readmission rates.
Hey Jim, we're trying to figure out how to improve the discharge process for our older adult population on family medicine. Do you have any suggestions?
Yeah, how about Project Boost?
Sounds interesting. Tell me a little bit more about it.
Well, it stands for Better Outcomes for Older Adults Through Safe Transitions, and it was part of the Hospital of Society Medicine's project to help us improve outcomes for older adults during the discharge process.
Could you tell me about how that works?
Well, let me see. Actually, we were on that team together. Why don't you tell me?
So, at any rate, we did complete Project Boost, and we found it very effective in improving our outcomes for our older adult population. Jim, can you tell us some of the numbers?
Yeah, we actually saw a decrease in our length of stay, our all-cause readmission rate, and our related cause readmission rate. So it really did help our organization achieve our quality and patient safety goals related to the discharge process.
That's right, and what we liked about it, it was a multidisciplinary team effort. We had physicians, advanced practice clinicians, staff nurses, care coordination, all pitch in and help. What I really liked about the project is how our nursing, especially the staff nurses on the floor, took ownership of the project. They really took ownership of the educational piece, for example. The evening shift and night shift nurses would grab a hold of the educational material that the patients needed. The next shift would then disseminate that material to the patients and make sure they are up to date on their educational process and their needs. So again, it really did help the outcome and improve our patients' ability to have a safe transition.
So it really was better outcomes for older adults.
It was.
Hello, I'm Patty Hart, Director of Nursing for the Children's Hospital and Women's Health here at Penn State Hershey Medical Center. The Penn State Hershey Children's Hospital is the only children's hospital between Philadelphia and Pittsburgh. And we're blessed to have very specialized physicians and nurses caring for those needs of our children in central Pennsylvania.
I'm one of the nurses that took care of the numerous pediatric patients that were admitted to our institution this past summer with hemolytic uremic syndrome. From a nursing standpoint, taking care of these patients was very challenging. We had to provide advanced peritoneal dialysis care for these patients, along with using our critical thinking skills to assess complications that could result from this syndrome. It was very challenging for us, but in the end it was very rewarding to see that the patients recovered successfully.
During the summer of 2011, a large number of children developed hemolytic uremic syndrome as a result of swimming in or drinking water from a contaminated lake. This is a complex and potentially very serious condition, and the physicians at the Penn State Hershey Children's Hospital served as a resource for area pediatricians helping them care for these children. We are the only institution in southern Pennsylvania that can provide tertiary pediatric care, including the advanced dialysis requirements and multi-specialty pediatric involvement that allowed these children to recover successfully.
An integral component of the Penn State Hershey Center for the Protection of Children is education. Education of our community partners, as well as faculty and staff of the Med Center.
It's important for our bedside nurses to feel confident when they're caring for our abused and neglected children.
Hi, I'm Jan Phillips, the Interim Director of Clinical Quality at Penn State Hershey Medical Center. We use data to drive our process improvement decisions in order to create a safe environment for our patients. The next couple of clips outline just a few of the process improvements that have been implemented over the last year and the outcome effects they are having for patients.
The Access Scheduling Project is focused on 7 principles. Included in these principles is a focus on the needs and convenience of the patients, as well as a simple, prompt, and courteous interaction with the scheduling staff. In the project thus far, we have improved the phone technology throughout the practice sites, provided standardization for training of all staff, improved processes throughout the practice sites, and provided for a monitoring system based on standardization for both the system itself and the staff that are involved. Throughout the Access project, there are also other pieces to help the medical group improve its goal of patient access into the outpatient settings as measured by the Press-Ganey survey.
Each month, we collect data related to delays in patient transport. From there, we analyze that data to remove barriers and improve processes to make sure that our patients are getting where they need to go the most efficiently. These improvements in patient response and decrease in delays have allowed us to improve our capacity management and increase the satisfaction with the patient transport experience.
Meeting staff needs with technology, such as the ASCOM phone, has allowed the HVI PCU nurses to remain at their patient's bedside. In a crisis, the nurses are able to stay with their patient, make the call to the physician, and receive the call back. No longer are the nurses having to wait by the phone. With this technology, it's a great benefit and allows for positive outcomes for our patients.
Hi, I'm Judy Himes, Director of Nursing for Medicine, Neurosciences, and the Cancer Institute here at Penn State Hershey Medical Center. The Department of Nursing practices under a shared governance model, which allows our direct care nurses to be able to provide feedback and initiate change through a series of unit-based and department-level councils. The next couple of clips showcase our teamwork and a dedication to a healthy work environment.
The professional practice model at Penn State Hershey Medical Center supports staff nurse involvement in shared governance. As an active participant in the Council for Education and Professional Development, I have been given an active voice in the ongoing development of the Healthy Work Environment Standards.
The Quality of Work-Life Council established our goals based on the Healthy Work Environment Standards of meaningful recognition, true collaboration, and effective communication. Our goal of meaningful recognition is accomplished through the works of our Reward and Recognition subgroup, through activities such as Nurses Week, the Daisy Award, and awards throughout the year. The goal of true collaboration is to have the nurses and physicians discuss the patient's plan of care every day. And the goal of effective communication is to help improve the nurse's ability to contact the physician that is caring for their patient. These advancements improve nurses' work environment, allowing them to provide the best care to their patients.
The Women's Health Team Builders, leading by example, taught the rest of the staff how to work in a more professional, respectful manner, becoming a better team. Not only does this have a positive effect on staff satisfaction, but it also has a positive effect on patient satisfaction.
Team Builders has not only helped me be a better team player, it has helped me with my communication skills, thus having better patient satisfaction when patients see that we are working as a team and having great communication skills.
Hi, I'm Judy Dillon, the Community Outreach Coordinator for the Department of Nursing at Penn State Hershey Medical Center. One of our 4 missions focuses on community service. We strive to give back to the community we serve through a variety of outreach activities. This past fall, we had the opportunity to give back to the community in a different light during the devastation of the flood that affected so many in our region.
In September 2011, our campus and the surrounding region was devastated by flooding. Our employees continued to care for our patients, and the organization cared for our employees who were unable to return home. In addition, we provided resources to patient family members and visitors on campus. These resources included lodging, meals, and local transportation. Nursing and pharmacy collaborated to provide emergency medication to visitors, such as insulin. Throughout the entire multi-day events, we, as employees, demonstrated our core value of compassion and our community mission to serve others.
Hi, I'm Darla Shihai, the Nurse Manager for Clinical Quality and Nursing Informatics at Penn State Hershey Medical Center. Patient safety is our #1 priority, and we constantly strive to make improvements in our process. Our nurse-sensitive indicators allow us to monitor how we are progressing in our quality initiatives. The following clips outline 2 of our initiatives from the past year.
Our team worked together to create a process to evaluate ventilator-associated pneumonias in our adult ICUs, along with the interventions we should all implement to prevent them.
And as we raise this awareness of our VAP bundle and its impact on the reduction of VAP, we've been able to reduce our VAP in the adult ICUs by 82%.
The Perioperative Nursing Division supports the many core and quality measures of the organization, one being the SKIP initiative, which is a surgical care improvement project.
An area where we were falling short was in our beta blocker documentation. So we worked with the Connected team to develop an electronic documentation form to assist us with this process. We are happy to report that since going live with the electronic form, we have attained our target of 90% for 4 months in a row.
Hello, I'm Patty Hart, Director of Nursing for the Children's Hospital and Women's Health at Penn State Hershey Medical Center. Patient and family-centered care is at the forefront of everything we do here at the Medical Center. Involving the patients and their families in every step of the process allows us to better provide care for them. The Patient and Family-Centered Care Coordinator is a role that helps us meet those specific needs of our families and allows us to meet all the needs of the children.
Patient and family-centered care is at the core of our care delivery system. We've used various teaching methods, such as presentations by our family speakers, to show how patient and family-centered care is applicable in our daily practices. Partnering with our patients and families helps us to provide the best care possible by actively involving everyone in the patient's treatment.
It is a pleasure to be here at Penn State Hershey Medical Center. I find it a privilege to be the Chief Nursing Officer here and to lead a team of people that produce the finest outcomes I've ever seen. I want to extend a very happy Nurses Week to you, and I hope that you'll enjoy this week and celebrate the work that you do every day and recognize each other for the fabulous work that the nursing profession provides to those we serve.